Can court or MRI tell stroke type? Imagine rushing someone to the emergency room after they suddenly lose speech or movement. The key question is often, what kind of stroke is it? Is it caused by bleeding in the brain or a blocked blood vessel? The answer lies in imaging tests like court scans and MRI scans. Both can help doctors figure out the type of stroke, which is critical for choosing the right treatment. A court scan, which uses X-ray technology, is usually the first test done when a stroke is suspected. It's quick, widely available, and excellent at spotting bleeding in the brain. If there is bleeding, doctors can act fast to stop it. Court scans are also good at detecting large areas of brain damage caused by a stroke caused by a blocked artery, known as ischemic stroke. However, they are less sensitive to small or early signs of ischemia, especially in the first few hours after symptoms start. Because they involve radiation, they are generally used in emergency situations where speed is essential. MRI scans, on the other hand, use magnetic fields and radio waves, not radiation. They are more sensitive than court scans, especially for detecting small or early ischemic strokes. MRI with diffusion-weighted imaging can identify tiny areas of brain damage that might not show up on a court scan. It also does a better job at distinguishing strokes from conditions that look similar but are not strokes, called stroke mimics. MRI is particularly useful for evaluating parts of the brain that are harder to see with court, like the brainstem and cerebellum. The downside is that MRI takes longer, often around 30 to 60 minutes, and may not be as readily available in emergency settings. In clinical practice, doctors usually start with a non-contrast court scan to quickly rule out bleeding. If the scan shows no bleeding but symptoms continue, an MRI might be ordered to confirm an ischemic stroke and to see how much brain tissue has been affected. Sometimes, advanced court techniques like perfusion scans are used to identify areas of the brain that might still be saved with treatment. In summary, court scans are fast, effective for detecting bleeding, and are usually the first step in stroke evaluation. MRI scans are more sensitive for early and small ischemic strokes and provide detailed information about brain damage. Both tests work together to give a complete picture of what's happening in the brain. Always remember, accurate diagnosis and treatment depend on thorough medical evaluation by healthcare professionals. If you or someone else shows signs of a stroke, seeking immediate medical attention is the most important step.